Is abortion morally acceptable for minor disabilities? In the UK, babies who are born with a disability such as club feet, cleft lips, and palates are being aborted. According to British law, abortions are allowed up to birth in the case of serious handicap, but the law does not define what conditions should be considered serious enough to allow abortions in late pregnancies. The Common Science and Technology Committee is carrying out an inquiry on whether or not the law should be more specific. According to data shown in the inquiry, there were 37 babies with cleft lips or palates and 26 with extra webbed fingers or toes who have been aborted. This raised serious concerns about abortions for minor disabilities in England. One might argue that abortion for minor disabilities in late pregnancies have a positive effect on parents because by undergoing genetic testing, it will help parents decide if they are capable of taking care of a child that is disabled and if that child would be more of a liability. However, many of these disabilities can be cured surgically without mothers getting an abortion. Having an abortion in late pregnancies for minor disabilities should be illegal. This does not only kill that child, but it puts that mother's health at a high risk. Having a child with disabilities does not only affect the mother and the child, it affects individuals of the community, especially if that individual is also handicapped. In one article called The Expressivity of Parental Testing and Selective Abortion for Disability, states that people with disabilities mostly think that parents who abort their child because they have a trait or will have a form of disability are discriminating against their child and others with the same trait. This might not be true, but by having an abortion for minor disabilities, it makes people view those parents as being inconsiderate. When parents decide on abortion for minor disabilities, it may affect other individuals who do not believe in abortion and also individuals that have some form of regret about abortion in the past. The way parents receive information about abortion may also be a major factor in whether they do the procedure or not. For example, if doctors do not give their patient the correct information about abortion to protect their future health, then that patient may not carry a child long term because of incorrect information during their first abortion. Individuals who seek a medical institution that does not have the correct information on abortion for disabilities tend to make the wrong decisions. Now moving back to England, having incorrect information on abortion, such as the effect that might transpire after the procedure and not giving women other options other than abortion might be a major factor on why these women would wish to abort their child with disabilities. When doing something as serious as an abortion, these women should seek the best medical help they can get. Then it also comes down to money. Without the proper financial income, women might not seek the best help because that can be expensive. But the help that they would seek that is not expensive might not give them the correct informed consent that would protect their health in the future. If the doctors make their patients think it is not unsafe to have an abortion, it would lead them to have the procedure. In the article Women's Awareness and Knowledge of Abortion Laws, a Systematic Review, it shows a study about how informed consent has a major impact if not being told the right way when it comes to abortion or any medical issues. The article states, incorrect knowledge of laws may affect how women enter the health system or seek services, and it likely contributes to the disconnect between official laws and practical application of the laws that influence women's access to safe, legal abortion services. In order to prove that this is true, researchers tested women under knowledge on abortion. The final results to this research on whether misguided information influenced women to make wrong decisions conclude that correct general awareness and knowledge of the abortion law and the legal ground and restrictions amongst women are limited, even in countries where the laws are liberal. When it comes to minor disabilities, there are options that mothers can take other than abortion to protect themselves and their babies. If the child is born with a disability such as cleft lip, webbed hands, or feet, they can have a normal life by undergoing a surgery, or the mother can choose another option like adoption. There are many people who do not care about disabilities and will love a child regardless of the situation. So why not choose adoption rather than kill that child by having an abortion? By making abortion illegal for minor disabilities, it will prevent less unexpected deaths, less illegal activities, and less emotional barriers that will cause discrimination.